Our first sponsor testimony is Senate Bill 78. The chair will now call up for its first hearing. The committee will hear sponsor testimony from Senator Hicks-Hudson and Senator DeMora. Please proceed when ready.
Thank you, Mr. Chairman, Vice Chair Lang, members of the Senate Financial Institutions and Technology Committee. Thank you for allowing me to provide sponsor testimony on Senate Bill 78, the Ohio Health Care Plan Act. The legislation will provide single-payer universal access to quality health care. I know that every person in this room, both the senators on the committee and everyone behind me, knows someone who has heard stories about people having to choose between health care costs and other necessary costs. We hear about people needing to choose between their insulin and rent, choosing between chemo or their house, or whether they will have the needed surgery or be able to feed their families. I hear those heartbreaking stories all the time, and it's even more tragic because it doesn't have to be this way. Senate Bill 78 will make these stories a thing of the past for all Ohioans. According to the 2024 Health Value Dashboard, published by the Health Policy Institute of Ohio, our state currently ranks 44th in the nation on health care quality. Even though we live less healthy lives than most people in the country, we spend more on health care than people in many other states. The average annual health care expenditure for a single Ohioan with no children is $3,262. A family of four could spend upwards of $8,540 annually on health care. This puts us at 35th in the nation in out-of-pocket spending, 35th in average employee contribution to employer-sponsored insurance premiums, and 37th in private health insurance spending. And all of these poor health statistics are even worse for disadvantaged communities, such as Black and Latino Ohioans. Ohio spends more to get less. This is simply unacceptable, but it doesn't have to be this way. Senate Bill 78 would provide good health care outcomes for all Ohioans while still being affordable. If SB 78 were to go into effect, 91% of Ohioans would see absolutely no increase in their taxes and would actually see more money in their paychecks due to employers not needing to provide their own health care plans. Passing this bill is just as economically sound as it is morally sound. This bill is introduced for years now, and every time we get our one constitutionally required hearing, and then it dies. I'm asking all of you here to truly think about this, to think about what part of giving more people access to health care for less money is objectionable. I'd like now to pass on to my co-sponsor, Senator Hicks-Hudson.
Good afternoon. I'm going to be a little bit slower than my colleague, but Chair Wilson, Chair Lang, Vice Chair, and members of the Senate Financial Institution Insurance and Technology Committee, thank you for the opportunity to provide sponsor testimony on Senate Bill 78, the Ohio Health Care Plan Act, with my joint sponsor, the incomparable Senator DeMora. To put it simply, what Senator DeMora has previously stated, this bill will ensure access to adequate health care for all Ohioans through a simplified health care delivery and billing system that will generate and guarantee savings on both sides of the consumer and on both the side of the consumer and diminishing administrative costs accrued by insurance providers. Among the dynamic and pervasive economic burdens that face Ohioans in our state today, healthcare continues to be one that is most pressing. Healthcare expenses, though affecting low-income and minority populations most viciously, is not only a challenge to them, but it is also a challenge to many of the Ohio regular population. Even for financially solvent Ohio citizens, the costs associated with a major health crisis can be overwhelming. According to the 2024 Health Value Dashboard from the Health Policy Institute, which my colleague already spoke of, we continue to see the impact it has on Ohioans, the average Ohioans, and directly affect their health care spending than their counterparts across the nation. There are a number of policies that Senate Bill 177 will implement to ensure accessible health care that bolsters Ohio's economy and protects our taxpayers. Firstly, and most importantly, this bill will offer every Ohioan the opportunity, hear me, opportunity to access comprehensive health care. Ohioans will have a varied choice of providers and be fully covered for all necessary health services and related medical expenses, such as routine outpatient services, prescription drugs, medical supplies, and medical transportation. These services would be provided without a copayment or deductible. Furthermore, their coverage would not be denied on the basis of pre-existing conditions. Payment to the healthcare provider for all covered benefits will be made from a single public fund called the Ohio Healthcare Fund. The Ohio Healthcare Plan would be administered by the Ohio Healthcare Agency, which will operate at the direction of the Ohio Healthcare Board. The board will have a given protocol to verify proof of Ohio residency. The board will also seek all necessary waivers, exemption agreements, or legislation to allow various federal and state health care payments to be made to the healthcare agency, which would then assume responsibility for all benefits and services previously paid for by those funds. In the absence of waivers from Medicare and Medicaid, both of which would be considered primary insurers, the Ohio Health Plan would be the secondary insurer. Until such time as waivers are obtained, the plan will not pay for services for persons otherwise eligible for the same benefits under Medicare or Medicaid. This legislation also requires the establishment of a technical and medical advisory board made up of healthcare providers and representatives of consumers to help establish policies on medical issues. Subsequently, a division of consumer affairs will be created to represent consumers' interests. Through the Ohio Department of Jobs and Family Services, workers who lose employment as a result of the plan's implementation would be eligible for training and assistance to acquire new employment. The Ohio Health Care Agency will determine in each case the appropriate amount of payment based on information from ODJFS. Funding from the plan or for the plan shall be obtained from a mix of revenue sources, including payroll, gross receipts, and income taxes. These funds are in addition to existing state and federal dollars already used in Ohio for services rendered under Medicaid and Medicare. Under this legislation, 91% of Ohio residents will experience no tax increase whatsoever. To once again echo my joint sponsor, Senator DeMora, I implore you to allow us to have more than just one hearing on this matter, but to have a full opportunity for others who are more experts than we are to come and present this case to the legislature, because we believe very strongly that this is something that is necessary for the financial and economic health of our citizens in Ohio. And with that, Senator DeMora and I stand to answer any questions for you. Thank you.
Well, thank you both very much for your testimony. Are there any questions from the committee? Senator Blessing.
Thank you, Mr. Chairman. And, looking at this, I was, seeing if there were some semantics here, if this truly was single payer, as you were saying. But I'm just a little curious. There's obviously a difference between single payer and what they might have in like the UK, which is, fully blown, public healthcare with the NHS. But I'm curious as to why you decided to go with single payer versus a public option. Thank you, Mr. Chairman.
I believe that single pay is most simple, and that and by its simplicity will provide, I think, more clarity for everyone that's involved, such as us as the individual and those that would be responsible for any type of financial requirements for it, as opposed to something other than that.
Brief follow-up, Mr. Chairman.
Please.
Yep. Thank you for that. The reason I bring that up is that, broadly speaking, when this topic has come up and, looking at polling on some things like this, public option, which would be a fully funded public option that actually competes with private insurers, does much, much better with Republicans than the single payer model. And for what it's worth, I mean, this is something that the late conservative commentator Charles Krauthammer, who's a doctor himself, used to comment on all the time that, we were headed towards single payer. However, the polling on the public option is better. It does draw on better support. And I think if you were going in that direction, that probably should be where you ought to go as a first step on something like this. But admittedly, I don't mean any offense at this, but, this is something the federal government should be able to tackle given the economy of scale. And I would understand you scoffing at that, given that Congress tends to not do anything at all. But at least you could see where I'm coming from. Thank you, Mr. Chairman.
Thank you. Other questions? Seeing none, this concludes the first hearing on Senate Bill 78. Thank you very much.
Thank you.